Hello, Dr. Demito is here again. And here's our second lecture in Epidemiology Week 2, the historic developments. So here are some of the objectives. We always have to have objectives, right? Why otherwise would we be doing this? We want to be able to describe the most important historic events, list and describe their contributions, and recognize the development and use of certain study designs. So, contributors in history of epidemiology sought to understand and explain the illness and death from an observational scientific perspective. They sought to provide information for the prevention and control of health-related states in the population. Now look at these dates. Far away, 1347 and 1351. Over 30% of the population in Western Europe, this was over 25 million, died from the Black Death or plague. In 1348, Venice lost 100,000 people and at least 1,200 died daily in Vienna. And there were over 60 million worldwide deaths from this horrendous illness. Now, Hippocrates, I remember studying about him when I had to take this course. I think, what course was it? I don't even remember, but it was so long ago. But he was the first epidemiologist, and look at the dates of here, 460 to 377. He became known as the father of medicine, and he wrote 3 books, Epidemic 1, Epidemic 3, and On Airs, Waters, and Places, which it was his effort to describe disease from a rational base instead of supernatural explanation. Because back in the day, they just didn't know how things happened, and they believed a lot that illness and disease processes was supernatural, that there were curses put on you that caused these things. And he suggested that disease might really be associated with the environment. And he wrote about the dangers of bad air. This representative movement away from supernatural expectations of the disease process. He observed that different diseases occurred in different locations, and he noted that malaria and yellow fever most commonly occurred in swampy areas. And he introduced terms like epidemic and endemic. So how forward-thinking was this person, Hippocrates, that he was able to identify that malaria came from people who were near swamps. So if he just had the time to dig a little deeper, he would have come to the conclusion that mosquitoes were the cause, I bet. All right, so Thomas Sydenham, this was 1624 to 1689. He believed that observation should drive the study of the course of disease. He described and distinguished among different diseases and some psychological maladies. Advanced useful treatments and remedies, including exercise, fresh air, and a healthy diet, which other physicians rejected at the time. They used things that were just so foreign to us today in our day and age. We know, we know bloodletting, right? Was one, and arsenic was another. That they used actually to help cure illness, when indeed it was not. It was not the cure. John Grant, 1620 to 1674, using the bills of mortality in London, he recorded age, sex, and who died of what, where they died, and when. He recorded how many persons per year died of what kind of event, and developed and calculated life tables and life expectancy. He divided death into 2 types of causes, acute and chronic. So he was like the pioneer of all of this vital statistic data that we now gather, that the health department gathers to help identify disease spots, where there is a resurgence in disease. I think of this now, I haven't seen much COVID in the clinics. This weekend I saw 3 cases. So to me, that perked up my ears. I actually saw an influenza B case, which I was shocked by, but that perked me up and said, you know what? I need to definitely be more cautious with my PPE because we may begin to see a resurgence. And I have been doing some reading in the public health channels. I use CDC a lot because their statistics are just really, really good. and they try to stay as current as they possibly can. But we found that there is a resurgence of COVID coming, so make sure that you're careful in the field out there. And the main symptom of this strain is a sore throat, very severe, feels like broken glass. Okay. So here's an example of the records and casualties in London. So you can see how he christened means those that were born, and then those who died. Increase in the burials in the 122 parishes and at the pest house this year, 993. Decreased of the plague in 122 parishes and at the pest house this year, 266. All right, James Lind, another man, 1716 to 1794. He applied experimental methods to identify that eating citrus fruits was effective against scurvy. Now, scurvy occurred often in sailors because of their lack of vitamin C. So he identified that if they ate the citrus fruit, that they would not get scurvy, or it would reduce the incidence of it. He made the clinical observation of experimental design and asked the classical epidemiological questions observed in the population. He observed the effect of the following on the spread of disease, and that's place, time, weather, and diet. So he focused on those things. Here's another one. Benjamin Jesty. He was a farmer, dairyman, in the mid-1700s, and he noticed that his milkmaids never got smallpox, but did get cowpox. He exposed his wife and children to cowpox. Interesting, right? Variolation. Chinese had observed for centuries that getting a weaker strain of smallpox was protective against a stronger strain of the disease. So this person, Benjamin Jesty, had the forthright to realize that if he exposed his wife and children to cowpox, they would have a less, if they were to get smallpox, it would be less, the disease wouldn't be as difficult on them, right? So the key difference between the variolation and vaccination is the method of immunization. Variolation involves administering live virus to develop immunity in the host, while vaccination, which was developed later, is an attenuated virus in response to a disease. So Jenner attempted to give a dairymaid exposed to a mild case of cowpox in her youth a case of cowpox by cutting her arm and rubbing some of the infected grease into the wound. She did not get ill, and he subsequently invented a vaccination for smallpox. How fascinating is that, right? I mean, I think it is. Ignaz Semmelweis in 1818 to 1865, so this was the mid-19th century, in a Viennese hospital. Semmelweis was a clinical assistant in OB. He observed a higher mortality rate among laboring women on the teaching wards for medical students. And here we go. This is what I talked about in our previous lecture, that the student doctors had unclean hands because they were working on putrefied cadaver material. He postulated that medical students and physicians had contaminated their hands during autopsies and transferred the pathogens to the patients, and he introduced the practice of hand washing using a chlorine wash to prevent the spread of the disease. So that was a long time ago. John Snow studied an epidemic of cholera that developed in 1848 in the Golden Square of London. He determined where the people with cholera lived and worked. He mapped a distribution of cases on a spot map and looked for clustering cases around water pumps. So he identified that the water supply was actually what was causing this increased risk of cholera. And so this was considered a natural experiment. So he was able to identify. And here's his spot map here. Here's a larger outbreak of cholera in London in 1854. Two different water companies supplied water from the Thames River to houses in the same area. Lambeth Cove water intake above London on the Thames, and Southwark and Vauxhall obtained water below London on the Thames River. But the Lambeth River Company, or the Lambeth Company, moved its source of water to a less polluted portion of the river, and Snow noted that during the next cholera outbreak that those served by the Lambeth Company had fewer cases. So he linked it to contaminated water supply. So very, very, I mean, to me, it's a brilliant observation of the disease process and the environment. Mortality in cholera in London related to the water company of individual houses and districts served by both companies. Look at the population, the cholera deaths. Big difference between the two, right? Louis Pasteur identified the cause of rabies, showed that bacteria could cause disease, and investigated how sheep and humans contracted the bacteria called anthrax, and he discovered a vaccine for anthrax. With Pasteur, Robert Koch established the germ theory of disease. He used photography to take the first pictures of microbes in order to show the world that microorganisms do, in fact, exist. He showed that anthrax was transmissible and reproducible in experimental animals. Identified the spore stage of the growth cycle of microorganisms and demonstrated that the anthrax bacillus was the only organism that caused anthrax in a susceptible animal. So Cox postulates. Developed the 4 postulates of disease to determine whether a disease was caused by an microorganism. So in order for a disease process to be caused by a microorganism, they have to have 4 of each of these 4 characteristics. The specific microorganism must be observed in every case of the disease. The specific microorganism must be isolated and grown in pure culture. This pure culture must, when inoculated into a susceptible animal, reproduce the disease. And the microorganism must be observed in and recovered from the experimentally diseased animal. So William Farr extended the use of this vital statistics and organized and developed a modern vital statistics system, much of which we still use today. Promoted the idea that some diseases, especially chronic diseases, may have a multifactorial etiology. Now, this is fascinating to me. I think that back in those days when all of these vital statistics had to be done manually, and today we have them at the touch of our fingers with a literature search, but we still have to ensure that cases of disease are being tracked, right? So I have patients who come in and they have chlamydia. I have to report that to the health department because the health department keeps track of all of the chlamydia cases and the syphilis cases and the gonorrhea cases. So all of those cases I have to report positives to the public health department, and they keep their vital statistic records. And those vital statistic records, it doesn't have any personal patient information in it, but it does have rates. And I mean, I could tell you, because I do the different clinics, I float all over the place. And the different clinics, I'll see we do a lot of STI testing. And I could probably just tell you from observation the areas that I work at that have higher rates of sexually transmitted infections. But you can go and look them up anytime you want. All you have to do is look up the vital statistics. Do a Google search. It's really very interesting. All right. Bernardo Ramazzini observed that disease among workers arose from 2 causes: harmful character of the materials that the workers handled, as the materials often emitted noxious vapors and very fine particles that could be inhaled, and certain violent and irregular motions and unnatural postures imposed upon the body while doing work. So he later identified as a chronic carrier of typhoid fever. This is Mary Mallon. So that's why they called her Typhoid Mary, because she was a chronic carrier. She caused over 250 cases of the disease, but she never had it herself. Isn't that interesting? From 1907 to 1910, she was confined by health officials until released through legal action taken by her. And it taught public health officials and epidemiologists the importance of keeping track of carriers. Lemuel Shattuck, we talked about him before too. He published the first report on sanitation and public health problems. He set forth the importance of establishing state and local boards of health and organized an effort to collect and analyze vital statistics and recommended the exchange of health information, sanitary inspections, research on tuberculosis, the teaching of sanitation and prevention in medical schools. So yes, tuberculosis was just ravaging the population during this period. Edgar Sidenstricker suggested that morbidity statistics be classified into 5 general groups in order to be of value: communicable diseases, hospital and clinical records, insurance and industrial establishment of school illness records, illness surveys, and records of the incidence of illness in a population continuously or frequently observed. Jane Lane Clapon, 1877 to 1967. In 1912, she published a novel cohort study showing the babies fed breast milk gained more weight than those fed cow's milk. She was an advocate for breastfeeding, midwife training, and prenatal services, and she developed the case control study. In 1926, she conducted a groundbreaking cohort study. The study followed a large cohort of surgically treated women with pathologically confirmed breast cancer for up to 10 years. It showed that breast cancer risk was greater for women who did not have children, married at a later than average life, or did not breastfeed. And it recognized that genes could influence the cancer risk. Alice Hamilton. In 1910, she was appointed the first occupational disease investigation body in the United States. She became a leading expert in occupational health and a pioneer in the field of toxicology. In 1919, she became the first woman appointed to the faculty of Harvard Medical School, and from 1923 to 1930 served as the only female member of the League of Nations Health Committee. Here's another one, the father of modern epidemiology, Wade Hampton Frost. He showed that epidemiology is an analytic science closely integrated with biology and medical science. He focused on the epidemiology of poliomyelitis, influenza, diphtheria, and tuberculosis. He, with Edgar Sidenstricker, investigated the impact of the influenza pandemic on 8 different localities in the U.S. and advanced our understanding of natural history of selected diseases. He made advances in the methods and scientific disciplines of epidemiology. All right, the Framingham study. This is a study that we talk about today. I mean, this is still a study that is relevant. In 1948, in Framingham, Massachusetts, cardiovascular disease study was launched. It was a prospective cohort study design, and between 1950 and 1952, investigators from the Framingham Heart Study identified and examined 5,127 men and women from the community aged 30 to 59 who were free from coronary heart disease. Information was collected on demographic data, medical history, cigarette smoking, and a number of clinical and laboratory parameters. The participants were followed and re-examined at regular intervals for the development of cardiovascular events. All right, so this was a big one. All right. Whoop. Not able to see this. The epidemiology of smoking and lung cancer. Case control studies assessing the association between smoking and lung cancer was started in 1950. And in 1948, the first report on smoking and lung cancer came out. So previously, there was no correlation between the two that was known. And as we stated in another lecture, physicians used to readily advertise, and they would say, oh, if you have a sore throat, you want to smoke a menthol cigarette. It will calm your nerves. Many things so that were promoting cigarette smoking. They didn't realize that there was a correlation until now. And unfortunately, a lot of the tobacco companies did everything in their power to try and suppress this knowledge, of course, right? So I don't think that it became readily known until the 60s, where there were big anti-smoking campaigns first began. And now We have our own problem. A lot of people have quit smoking. Very difficult to even find somebody who smokes anymore, though they're still out there. Cigarettes are so darn expensive, they're cost prohibitive. But now we have a population of people who are vaping nicotine. So it's one for the other. And we don't know the long term events of vaping, or effects of vaping rather, because it's relatively new, a new thing going on. So only time will tell. And I hope that this gave you a little bit of insight on the advancements, and how important epidemiology is to healthcare and population health, how important it is, and how you can correlate the two together to make the topic interesting. Because I know when you first think, oh, I'm taking population health, you think this course is going to be a snoozer, right? But it's not really. There's so many interesting, passionate things that you can find and pull out. You just have to know where to look. And that's what we're going to do on our journey through population health.